The futures of hundreds of the country's junior doctors are uncertain tonight as they wait to be placed after completing their community service. In a country where doctors are in short supply and hospitals are severely understaffed, their continued unemployment is described by health sector bodies as outrageous and unacceptable. These are qualified medical personnel whose skills are vital to the health and well-being of the country. So have the announcements by health officials done anything to provide certainty and leadership? Let's ask Dr. Akhtar Hussain, who is the chair of the South African Medical Association's Employed Doctors Advocacy Forum. Welcome, Dr. Hussain, as always, and thank you for your time. You know, when you boil this down to individual stories, the hope of a family in a village, languishing at home because he or she can't get placed, or others being mocked by their peers for spending so much time and effort studying, only to come back home with nothing. How big a crisis is this for these unemployed doctors and then for the country?
Thank you very much having me, Iman, and SABC's listener. This is not the crisis for this 2024. We have been coming and explaining and telling the Department of Health that there's a huge shortage of junior doctor, frontline doctors. Even the minister himself admitted in Parliament that there's a huge shortage of doctors in South African health system. But now, yesterday, we had a very big hope that he will announce some way forward and will absorb whatever number he mentioned that unemployed. I will tell you how many unemployed, because last 2 months, those doctors qualified 2,200 community service doctor. Now they are fully registered as the independent practitioner doctor. None of them got placed in a full-time in public sector. Maybe some of them got a part-time somewhere or doing some locum to the clinic, but that is not the job. The issue is why government knew about it years after years. There's a crisis in the Department of Health. There are no vacancy advertised, whether it's a public sector in the rural hospitals or urban area. We don't see advertisement hardly. If they advertise 1 or 2 posts and there are no guarantee, those posts will be allocated to the junior doctor. What is happening last 5-10 years? That anybody resign from the post, they delete that post and they say zero vacancy. If the minister, yesterday we were hoping and we had a very hope that he will announce some way forward and absorb those unemployed junior doctors. They are our future doctors.
Yeah. And
he said 673 doctor post will be advertised, one of the province. And the same time he's mentioning there's a severe budget cut for the health. There are no fund, no money. You see in the headline.
Well, that's where I want to come to, Dr. Akhtar, if you allow me. The health department saying there isn't enough money. And they say the healthcare budget is under pressure. Is this good enough? As you say, this problem has been a decade or more in the making. There should have been some planning. There should have been some preparation so we don't arrive. And as you say as well, we've been having these interviews for a while, red flagging, the position and the plight of doctors. Is it good enough that they say they don't have enough money?
Not totally. It was a disaster. It caused more anxiety and distress in the junior doctors. They were very hopeful that they will have something going forward in next few weeks. But yes, yesterday it came out disaster that there's nothing in the way coming. In fact, minister said they must go and do private practice. You know, private practice, how difficult it costs a lot of money, and the medical aid is another challenge. We won't discuss that. So just to go and start private practice is not possible for a very small junior doctor. And there's not enough space in a private sector as well. So there are no future planning. There are no going forward human resource planning in the Department of Health. On the top, they knew that every year 2,400 new doctor or junior doctor will qualify. Last 6 years, they have been first year to final year. Why they didn't make the planning? On the top, minister said the junior doctor getting high-end salary. The junior doctor salary is not higher end. The salary minister was mentioning, those are the senior specialists, chief specialists, or chief executive officers.
So how much do they get, Dr. Hussain?
Truly speaking, a junior doctor first year, they get without overtime, without night duty, without working excessive hour, basic salary is coming around 35,000. If they don't do night duty, at least 5 to 7 night duty a month, 220, 240 hours total work a month, then they will earn around 55,000. If you earn 55,000, you tell me how you're going to survive. You have to pay rent, you have to pay health professional council fees, you have to buy a car, you have to pay petrol, schooling fees, and union fees or association fees. The HPCSF fees is also going up again. So the amount of money a doctor earns is not that he's earning for himself. He's got a family, he's got parents, he has to look after extended family because everybody is waiting for that doctor to way forward.
Yeah. So, Dr. Hussain, Dr. Patla says there's no such thing as automatic placement, that junior doctors, like any other professionals, must compete for jobs. Is this a fair statement?
No. We're not saying you must just give that doctor a job. We are saying you must advertise vacant post. Because you are deleting the vacant post, you're shrinking the vacant post. If one hospital got 20 doctors needed, now you will find only 7 doctors working. What happened? That 13 medical officer posts, they disappear to save money. Saving money is the motto of the Department of Health at the moment. That's why they're not appointing. And you see the reflection. The patients are suffering. The long queues are there.
Well, that's what I want to go to next, if you don't mind, Dr. Hussain, in closing. What impact is this having on doctors who are deployed and their workload, given the demands at the country's public health facilities?
Public health facility is in disaster situation. It's not collapsed. He said it's not collapsed. I think it collapsed long time ago. It's already in ICU. And it's a two issue. Is the doctor stress, burnout of the doctors because overwork. And the second issue is patients are not going to get quality healthcare service because one doctor must see 50 to 100 patients. How is possible to get a quality healthcare service? And on the top, you say medical legal litigation came 900,000 or 900 billion or whatever. Litigation will happen because there are no doctor to work. You're not appointing enough healthcare worker.
All right, Dr. Akhtar Hussain, thank you for sharing the picture there. And again, it's going to be a conversation we continue to have as we bring in more of the role players. Dr. Hussain is the chair of the South African Medical Association's Employed Doctors Advocacy Forum.